Welcome, everybody. Today we're going to be discussing during the holiday season. We seem to have an increase in calls for people feeling lonely, depression, suicide attempts, and we just wanted to come before you and give you guys some ideas if you see this in family members or anything like that, kind of what you can do. And today I have with me Dr. Witucki from Ozarks Community Hospital, and I also have Chief Orr. And I'm going to ask them a couple of questions. I'll start with Dr. Witucki here, and I'm going to ask him a question. Tell me kind of what someone could do if they see a family member that they see might be struggling with something. What are the signs? And
Sure. Well, I think the signs, when you're worried about somebody, they might be depressed. You look for, there's a number of symptoms that go along with depression. Certainly a change in their mood. Maybe they've become more sad, maybe more irritable. Oftentimes there's changes in behaviors and habits. So changes in behaviors, maybe you're struggling with school or struggling with work, maybe changes in friendships, just changes in behavior maybe in general. We know the people in our lives and when they change, and it's good to take note of that. Oftentimes you might also see some isolating, a lack of interest in things, even discussions that they're not as happy if they're not enjoying things as much. I think those would be a number of symptoms that if you saw those, you could be concerned about. And certainly if it lasts for a period of time. Everybody has their moments, but when it starts to last for a period of time, that's when we start to really worry about that.
so how would someone tell the difference in someone just having a down, you've gone through a breakup or something and you're having a down few days versus something that might need to go a little farther than that?
It's probably intensity and then how long it lasts. If someone's struggling and they're struggling with sleep for a couple days, maybe I'm not concerned about that, or if I'm unhappy for a couple days. But if it lasts for a while, probably more than 2 weeks is what we look at for sure. If you really see some of those changes for that extended period of time, I would be more concerned.
Okay.
And then I think I would want to talk about it. I think people sometimes struggle to ask people questions or to kind of pry into what's going on, but I think that's a really important thing when it comes to depression and suicidal issues, is to make sure that if you do have a concern to talk about it and listen and kind of be there for people.
Yeah. So what would someone do if they were feeling like they were having these problems? What would be best for how would they go about it, notifying someone? Should they tell family members?
Certainly, I think it's good to talk about it, and is there someone in your life who you feel comfortable to discuss that with? Maybe your partner or a friend, a close friend, or a coworker. Maybe for kids it might be a school counselor, it might be a teacher. But I think the important thing is to talk about it. I think when we keep it inside, that's where I think sometimes people really get into trouble.
Mm-hmm. And is there a time that a family member should really, at that point, jump in and be more proactive?
I think we all kind of have our thresholds for that, and I think if you talk to someone and you're really concerned about what they're saying to you and maybe how their behavior's changed, I think it's trying to figure out, is this a time we go talk to our physician and talk to them about what's going on here and what they think, or can I, call about some type of counseling? I think it depends also probably how serious it is, and you could go from talking about it to going to the doctor's office to maybe, calling 911 or something like that, where you really felt like we really don't have time for that, or this is really serious and I don't know what else to do here. You kind of maybe have to take it to another level where you can get someone else involved in the moment.
Okay. Good. Chief Orr, what would someone do if, people are kind of scared to call 911? When should you, when should you not? I know you guys get a lot of calls on this type of thing. When would it be appropriate for someone to do that?
So as Dr. Witucki said, if you're noticing these signs and you feel that, and it reaches the point that you feel the person is a threat to themselves, or if it's you yourself and you don't know why you're having an uncontrollable urge, maybe it's a medication or something that's just, at this point, it's perfectly okay to call 911. We are more than happy to come out and check somebody out, even if we get there and that person is more than happy to go to see a physician. We're having a moment, everybody's comfortable with them, you know, making the appointment. We're more than happy to come out and check them out. If you reach that point that it feels that they are a threat to themselves, by all means call 911 and we'll be glad to come out.
Is there anything else you guys would like to add that I haven't asked you?
With the suicide hotline, it could be you or your loved one, even if it's somebody that you're cared about or worried about, you can call the hotline and they'll help manage you on how to deal with that pain or that loss. And that's, I think, one tool that we could utilize a lot more of if you're having questions about it. So.
Very good. Dr. Witucki, you have anything else you'd like to add?
You know, I think a little bit on the same lines. I guess I was thinking that I think it's important to talk with people. If you know, with the people we care about, people in our lives, if we are concerned, I think that sometimes we're afraid to talk about it. We're afraid to ask about it. You know, you don't have to be an expert at it. You don't have to know all the right answers. I think a lot of times it's just really about listening and letting people know that you're there and maybe help them get the help that they need. So I think it's important to be aware of each other and be supportive.
Thank you guys for spending a few minutes with us. Ultimately, we just want you to have a great holiday season and just be aware, know what's going on around you with your family members, and hopefully we can help someone. Thank you guys.